Speaking of the National Guard, we're going to bring General Harris in. General, thank you for being here. Good to see you again. And I want to start by congratulating you and your bride, Angela, becoming grandparents. Fantastic. I know that's, Fran, I can say that that's a great experience. So, General, thank you. Thanks for joining us, and kind of tell us what's going on with the Guard in regard to the testing around the state.
Well, thank you, Governor. Good afternoon. I can say for sure that being a new grandparent and watching my daughter and her husband go through the process and having to deal with the measures that are in place as a result of this coronavirus certainly drives home the point that it's not only here, but it's going to be here for a while, and that we have to be prudent to protect not only ourselves, but the most vulnerable segments of our population. And while we know it's here for the long haul, we know that controlling the spread of the virus is job one for us, and we are dedicated to that, and testing is an important part of that. So the National Guard is fully committed to the testing, and I want you to know that our members are so proud to be a part of this process because it is so good for them, and they're so dedicated to doing something this important and this meaningful. So far we started in the nursing homes, and we've done testing in over 258 nursing homes and tested over 25,000 people. And that number continues to increase and will continue to grow. So we're building additional capacity as we look at this community, this pop-up testing, which is an important part, as I said, of not only spreading the disease, but also in helping us protect the economy as things open up. So far, we've done 19 of those sites, and we've tested over 5,000 people there. When I say test, we did a part of the test, which is the sampling, and then we send it off to the lab for the actual testing to be done. It's important to note that this is a step in the process. As with the nursing homes, where that starts with a clinical assessment, this also ideally starts with an assessment by the Department of Health. They're watching a number of measures, a number of leading indicators, which will lead us to those communities where the risk is highest, and we can start the testing there and help control the spread of the virus before it becomes an outbreak. That's the ideal situation. So we get the clinical information on the front end. The Guard goes in and does the sampling. And we have configured ourselves and our teams so that we can put small teams at the small sites and larger teams at the larger sites. So we're flexible, and we're able to scale that to meet the needs of the local health departments. So we go in and augment the local health departments, do the sampling based in those areas where we think the risk may be highest. And then the follow-on actions are probably as important as what we do with the testing. Where the results go, those positives, who gets them, the local health departments, what they do with them, obtaining that voluntary information from those people who test positive to find out who they've been in close contact with, and getting those folks to voluntarily isolate so that the disease can be controlled and not result in a hotspot or an outbreak. Now, when we do know that we have a hotspot or an outbreak, of course, as you mentioned, Governor, as we have in southwestern Ohio, we'll be there, and we'll help with the testing in order to get that disease back under control. Our teams are comprised of medical folks. They are folks who at least are an EMT or paramedic in their local community. They have the training and the experience and the background. They simply wear the uniform in addition to their civilian job. So they come with a wealth of experience. They're going to treat everyone that they collect a sample from with respect and with dignity. That's our watchword. We ensure that when the community comes in contact with the Guard, that it's a positive experience. So we collect the sample in the most least invasive way possible. Sometimes that's difficult, but this is complex. There are lots of different samples out there. Different labs take the samples different ways, different forms. So our teams are comprised not only of those medical professionals, but all the administrative support and all logistics support to not only get the collection material, but also get the samples where they need to be to that lab that can process them in the most timely way. We're very respectful of the medical information that we collect. We don't keep it. We pass it on to the health department. And I want to emphasize that the local health department has a lead here. We're here to support them. This response is local. We're here to support the local response, and we do the best job that we can. But the local health department's responsible for not only making sure that the community is aware of where these sites are but also in the overall strategy for what happens with the results afterwards. So it is great pride for us to be able to support them in that effort, because we know that they're putting in yeoman's work and that we're in this for the long haul. So the National Guard is here. We're committed to this endeavor for as long as it takes. As I mentioned, we're building additional capacity so that we don't degrade our operation in the nursing homes as we move into this new space of community testing. But we're committed to it because, as I mentioned, it's very important. It's very important. And in addition to all the other measures, testing alone doesn't do anything if the other measures aren't in place. If we don't have the tracing that follows up, if we don't have people properly wearing masks when they go out into public spaces, if we don't have the social distancing, then testing simply becomes a way of chasing measures and metrics, and we lose our ability to get ahead of this disease. So we're awfully proud to be involved to help control the spread of this virus until there is a vaccine, and we're in this for the long haul.
Well, General,
so, Governor, thank you for the opportunity to participate. Thanks for an opportunity to be a part of the team. And as I mentioned, our Guard is awfully proud to be a part of this very, very, very important effort. Thank you, sir.
Well, General, I can't thank you enough and the men and women of the Guard. As you know, several of them were in here at our last press conference, and we got tested, and it was certainly not a traumatic experience. They did a great job, and we got our results back. So we hope we know everyone will have a good experience. And we just would again urge everyone, particularly if you're in those areas where we're seeing a significant uptick in Hamilton County, for example, Montgomery County. We're also starting to see some in Cuyahoga County. We would just ask you to get tested. But General, thank you. We're very grateful. Good to be with you.
Thanks, sir.